Okay, good afternoon, everyone. Thanks for joining us today. We're going to be talking about same-day joint replacement. My name is Jenna Danko, and I'm a physical therapist here at Mercer-Bucks Orthopedics. So a little background about me. I went to Ithaca College in upstate New York. I graduated with my doctorate in 6 years. And then after I finished my schooling, I did an outpatient orthopedic residency in central Pennsylvania, Harrisburg area. So it was a 1-year specialized program, and I treated a whole bunch of orthopedic conditions. And now I'm here at Mercer-Bucks Orthopedics. I work mainly in the Lawrenceville office, and I also work down in the surgery center. Okay, so what is outpatient joint replacement? So outpatient joint replacement is a new pathway for select patients. There really is no difference between the surgery itself, but there is a difference in the way that we modify pain and we get you up and moving earlier than normal. So it's definitely a strict protocol, and we have been working on this protocol to perfect it. You also have a dedicated multidisciplinary team that starts with you from beginning to end. So the nurse that greets you in the morning is the same nurse that is with you all day and then sees you out the door. And if there's any problems, we'll try and fix them. So who is a candidate for outpatient joint replacement? So outpatient joint replacement should only be performed on patients who are healthy enough for the surgical setting. So if you have any outstanding health conditions, or if you have a more complex surgical setup than required for you, we will get you in an inpatient setting instead of outpatient. And then we also want to have patients who are comfortable with the idea of going home directly after surgery. So if you have too many stairs at home, or you don't have the appropriate or adequate help, we suggest you do that on an inpatient setting. So advantages of the same day replacement. Mercer-Bucks Orthopedics was the first in our area to perform that. And again, I want to highlight the more strict protocol for pain control and early mobility. About 3 hours after surgery is when we get you up and moving. So that's really, really quickly. Our team is truly dedicated to your success and your joint success. And the major advantage of outpatient joint replacement is that you don't have to stay in a hospital. So sometimes with hospital stays, there are different complications, including infections or some kind of vein problem. So you don't have to worry about acquiring any of those infections. And we have increased overall patient satisfaction. So instead of recovering in the hospital for a couple of days, you get to go home. Rapid recovery programs have been shown to decrease complications such as blood clots after surgery, and there's an overwhelmingly positive response to our surgeries. So what to expect the day of surgery? I want to back it up just a little bit. About 2 weeks before you have your surgery, we do have a pre-op meeting. So at that meeting, you meet with a physical therapist, a specialized nurse, and then anesthesia. So we screen you for any complications that you might have, which might not let you have same-day joint surgery, and we make sure we have ample time to answer any questions. I want to highlight that this includes the nurse. So this nurse will be with you from start to finish. So if you have any questions or any difficulties, she will be there with you. The day of surgery, you will also meet with your anesthesiologist and surgeon one last time to go over any questions or concerns you might have. Surgery to recovery room. When you get into your recovery room, you won't be able to move your feet or your legs yet, but that's just a side effect of the spinal anesthesia. So don't be alarmed. Gradually, that will come back. I do always suggest that people start to try and wiggle your toes and try and move your ankles up and down to make that come back quicker. I will come into your room about 3 hours after your surgery is over, and I want to make sure that you can move your feet and you can feel the sensation as I'm touching along your legs. I don't want you to stand up if your legs aren't ready to stand and if you can't feel the ground beneath you. So we make sure that you are safe enough to stand. Before we stand you up, we make sure you can sit first without feeling dizzy or woozy or nauseous. If at that point you do, don't worry. We let you recover some more and lay back down. Then we will get you standing. We trial you to the bathroom to make sure you can walk a couple feet. We make you use a walker, and I do teach you how to use it so you are nice and safe and use the correct mechanics. So we walk you to the bathroom, and once you do that nicely, we get you back in bed, get you dressed, take you upstairs, and teach you how to use the stairs. Many people have stairs to either get into their house or once they're inside their bedrooms upstairs. So we teach you how to do stairs the correct way. We also get an x-ray of either your knee or your hip. That way we know that the joint looks good. And then we get you back into room, you finish up your medication, and then you're ready to go home. So typically your day is about 7 to 9 hours, and we usually get you home by 2 to 4. So it's pretty quick turnaround. In the next 2 weeks, you will be visited regularly by your home therapist. So the home therapist comes in the next day after surgery. They give you about a 2-hour window to come in. They make sure to check your dressing, make sure everything's okay. And at that point, please ask them any questions about your home life, if you have trouble moving around or any particular questions. After your surgery, you will have an appointment with your surgeon. And I want to note you can't drive at this time, so make sure you bring somebody who will drive. At that point, your surgeon will probably give you a script for outpatient physical therapy. That way you can get into the clinic and we can strengthen you more and make sure you have more mobility and motion in that knee. Your home physical therapist will definitely advance you in your mobility and anything you need to do at home. But we like to get you in the clinic to push you even further. Okay, so I know that was pretty quick, but here are some frequently asked questions. So how much pain will I have after surgery? Everybody's pain tolerance is different. On average, pain is generally no more than a 4 out of 10. But again, you will have a nurse by you throughout the whole day, and she can efficiently moderate that for you. What kind of incision will I have? On the hip, it's on the side of your leg, usually 6 to 8 inches long, and then the knee is the front of the knee. What should I do when I get home? We ask that you please rest. Please don't do anything. You can do the yard work later. You can put laundry away later. Get home and rest. If you are having your knee replaced, don't put anything behind your knee while resting. We really, really want to get the knee as straight as possible as soon as possible to get you functioning better. So if you want to put ice on it, it's either the front or the side, nothing under your knee. When can I take a shower? So you can usually shower the next day. Please wait until the therapist arrives. That way they can address your incision and see if there's anything that's a little funky going on. And then can I go up and down the stairs? Yes, but keep it to a minimum. We teach you how to go up and down the stairs just so you can get home and get safely in there. Do more stairs when the home therapist arrives. Again, go home and rest. So here are our surgeons that do the same day joint replacement. And if you want to schedule an appointment, please visit our website or you can give a call. All right, and now I'll open the floor up to any questions. Okay, somebody said, if I have mild arthritis of the knee, am I a candidate for the same day joint replacement? So what we like to do is do any kind of conservative treatment first. So definitely have that open conversation with your doctor, and whether it be physical therapy before surgery or an injection or any other path your doctor would like to take, talk to him first, and then you'll get the correct pathway. Great question. Okay, another question here says, how long do you estimate after knee surgery for full recovery? So again, everybody is different. And if you have a more serious medical past, it will take a little bit longer. But generally, it takes about 4 to 6 months to have a full recovery. But you should be able to wean off of the walker and off of the cane in about 4 weeks. So someone said, I missed the first few minutes. You said something about spinal anesthesia. Okay, so for spinal anesthesia, so they do spinal anesthesia on the patients. Again, talking to your doctor and the anesthesiologist about that. But it takes a little bit for your muscles to start moving again and your sensation to come back. So that happens in about 2 to 3 hours after surgery. So we don't want to stand you up if you can't feel your feet or move your muscles. So we make sure your sensation back and your motor is back before we stand you up. Do you give spinals if the patient is on blood thinners? We will go over that in the pre-op meeting. I don't address those kind of questions. So I would talk to your doctor first and then the anesthesiologist about that. We do perform surgery here if people are on blood thinners, but we don't supply blood in the operating room, so we want to make sure you're safe enough to get the surgery here. We don't normally do general anesthesia. We usually do spinal anesthesia and then a nerve block either by the hip or the knee to help reduce the pain. With general anesthesia, it takes longer to recover, so we want to get you out within those 7 to 9 hours. So if we did general, it would take longer and you might not be able to go home. So how should you prepare for knee surgery, and should you lose weight if you have enough time? The short answer is yes. Every pound you gain or lose is 5 pounds of pressure on or off your knee. So if you lose enough weight, you take more pressure off your knee, which will give you a better outcome both before and after surgery. We provide you with a packet of exercises to do. So we always recommend you do exercises because the stronger your knee joint is before surgery, the better outcome you will have. So someone said, I have severe arthritis in my knee. Cortisone and gel injections have not worked for me. I keep getting told to wait for knee replacement, that I'm too young. Am I a candidate for this? Just turned 50 and I feel it will be harder to recover if I wait. Okay, so definitely contact one of our doctors. We do have people as young as 50 do the joint replacements. So if they feel you're a good candidate, then I would suggest doing so. And then the number is there, and then the website is there too to make an appointment. Okay, 2 questions about, are you awake during the process? You usually are in one of those twilight zones, so you don't really, you're not awake, but you're not in general anesthesia. Okay, somebody asked, are blood clots a problem? There's always a risk of blood clots with any surgical procedure. The good news is that we send you home with compression stockings and a compression unit. So the compression unit is an automatic pump that we recommend you using if you're sitting down or laying down for 15 minutes. So these will pump your legs and reduce the risk of clotting. And also with our early mobility, you stand sooner, which also reduces the risk of blood clots. So we do everything we can to prevent that and reduce the risk. And then, will you have any similar presentation for non-same day surgery? So we don't have one planned for non-same day surgery, but if you are interested in that, our next slide has an email. You can email the programs and then we can get something together for you. Is there a pre-op protocol for in-house similar to when a hospital stay? I'm not quite sure what you mean by that question. If you could elaborate on that. And then I am on warfarin. How does that affect me? Again, please talk to your doctor about those things. I don't want to give you any information that's generalized instead of just tailored to you. So please talk to your doctor about that and see if that makes you still a candidate for same day. Okay, if you have varicose veins behind your knees, could this cause complications with surgery? Not that I've come across yet, but again, I'm going to say the same thing. I sound like a broken record, but please talk to your doctor about that before surgery. He will have more information on that. I don't want to give you any information that would be wrong and not tailored to you. Okay, so I had a hip repair and had to do a special shower, special wipe down, clean sheets, and clean bed clothes. So yeah, for our hips, we have to maintain those special hip precautions after surgery. So we always ask you to get an elevated toilet seat. If you're wanting to sit down in a shower, an elevated shower chair. And you always do want to keep the surgical area clean. So make sure you do provide clean attire and make sure your home is clean, definitely. How is the partial anesthesia done? So they do a nerve block. Depending on where your nerve runs in your leg. So they do a nerve block to the nerve that supplies sensation around the knee joint. So you get your spinal anesthesia done. So they have you bend over and do the anesthesia shot in your spine in the nerve that supplies that area, and then you get the nerve block above. And they'll go over all of that during your pre-op meeting. Is this procedure covered by most insurance plans? You'd have to call and talk to your insurance plan about that, but we haven't had any problem with patients coming in to do that. We do many of these, so I want to say this is widely accepted. And then the success rate with this procedure. So the evidence is very good and very positive for getting people home, in their success rate is trending definitely to the positive. If you're talking success rate with a joint that you can be fully functional on and have a full recovery, it's definitely different between every person that comes in. But we normally hit that special range, that 120 degrees of knee flexion and 0 degree knee extension. To have a really successful surgery, you also have to have great post-op care, meaning you have to go to physical therapy and do your home exercise programs, and then talk to your surgeon about any complications that you think you have. So surgery is usually great. We get people back home, and the rest is kind of maintaining your physical therapy, stretching, and doing all your exercises. So the success rate increases with the more you put into it. Any other questions?
Hi, Jenna. I think that I have some questions here that I can see that you can't. So I'm just going to ask those to you. So I think the same person who asked about the pre-op protocol for in-house versus the hospital, she is also asking, apparently, I think she had probably something done years ago, and they had like an infection control process where the areas that they were going to have surgery on had to be wiped with special wipes and things like that. I can say in our booklets, our knee replacement and hip replacement booklets, because I worked putting those together, that there is a process that they go through, including disinfecting those particular areas. So I think that would be, yes, there is a pre-op protocol for our surgeries like there is in a hospital. So I hope that that answers that question. Typically, how long before you can take a walk after surgery?
Okay, so as far as taking a walk, like around the block, it will depend on how your recovery is. We try not to have you take a walk around the block with a walker. So if you're thinking using a cane, I would say around 4 weeks, but definitely talk to your home therapist about that, because you might progress quicker than expected. So if you do, we don't want to hold you back, but you might progress slower than expected, and we want you to be safe. So definitely talk to your home therapist about that after surgery.
Okay, we have another person asking if we could, they got here a little late, if they could put a few of the slides up from earlier on. You will be, each of you who registered for this webinar will get a link to the recorded version in a day or two. So that will go out in a couple days, so you will be able to review those slides then, if that's okay. And then Jenna, I think there's a chat section too. So a couple more questions, if you don't mind.
No, that's okay.
It says, does Dr. Polikoff perform one-day hip replacement?
So the slide up here are all of our surgeons that do the same-day joint replacements down in the surgery center. And we have a new doctor coming on, Dr. Cyran, who is also going to do new joint replacements. So Dr. Polikoff does not, at least not in the surgery center.
Yeah, so Dr. Polikoff has been affiliated with our practice for quite some time. However, he kind of just joined the practice 100% recently, like the 1st of August. And I think his primary goal is to be more of a consultation type of physician at this point. He's moving a little bit away from surgeries, but because he has so much extensive knowledge over the years, I think he's been in practice for like 35 years. He's just going to be a huge benefit to our practice, being able to have kind of the pre-operative consults with patients and being able to fully discuss what they can expect prior to the surgery, during the surgery, and post-surgery. So we're really excited to have him on board. We have a patient of Dr. Kojo's watching. Thank you. So yes, be sure to reach out to him with any questions that you have. And then Jenna, here's another one. How safe is the surgery center doing COVID, especially since you need clearances from your doctors and dentists, which means more doctor visits?
Great question. Great question. So before you get your surgery done, you need to have a COVID test to make sure you don't currently have it. We're abiding by all laws, so everyone is masked up. We're using gloves. Every patient in there must wear a mask. You get hairnets as well. So definitely the test beforehand. I know that it means more doctor's appointments and more clearances, but we hope that everybody in the medical field is abiding by the standards that are set. So we're doing really well. There's been no fallback of patients having COVID after being here.
We have taken a lot of precautions, as Jenna said, with regards to the surgery center and COVID. We do have, if you're interested, if you go on the Mercer County Surgery Center website, which is mercercountysurgerycenter.com, there is a live video of, not of an actual patient, but kind of what the protocol is of how we are handling COVID at this point. So it's kind of a walkthrough, a virtual tour of what you can expect once you go in for a surgery. So that might be something you might be interested in taking a peek at prior to making any decisions. I do have a question here. I haven't heard of Dr. Siren at MBO. Is he new? He actually hasn't even started with us yet. He is starting on Monday. He is a joint replacement surgeon, and he is coming to us from UCLA. So he's been in practice for quite some time. He's moving back to this area because this is where he's originally from. He is also has a specialty in orthopedic oncology. So he will certainly be a huge asset to our group. So we're very much looking forward to having him start on Monday. I think you'll really enjoy his bedside manner and just his knowledge overall. Jenna, okay, forgive me if I say this wrong. I'm not sure if you can see these, so that's why I'm asking you. So is the additional anesthetic Propofol, for example? Sorry, I know I probably said that wrong, but I'm guessing.
And no, that's a great question, and I do not know the answer to that one. So during your pre-op meeting, you will meet with the anesthesiologist, and they will go over those details. And you can also ask your doctor too before scheduling surgery, but I'm sorry, I don't know the answer to that one.
And again, if there are any questions that you think of that we weren't able to answer or that comes up after the presentation, if you see on your screen, it just says to contact us at programs@mbortho.com. Please feel free to do that, and either Jenna or myself will be sure to get answers for you for any questions that you may have. But I think that's it. I think we've answered all the questions right now. Jenna, thank you again so much. It was such good information. Same-day joint replacement is a very exciting thing for us. Now it's getting patients back into the environment that they will do best in with recovery. And as Jenna had said, we are one of the first to start this in the area. So we're very excited about it as an option for patients, if that's what they choose to do, if that's the best for them. So again, thank you for joining us. Please feel free to ask questions at programs@mbortho.com, and you will be getting a recorded version of the webinar shortly, so keep an eye out for that. Enjoy the rest of your day. Thanks again.